will be also about issues arising from language differences. So there's impact on patients and staff, communication difficulties, misinterpretation of medical terminology, and isolation and frustration when there are those barriers there. There are many language barriers such as social and economic impacts. Social impacts are the isolation and discrimination, and economic challenges is difficult accessing services and higher paid jobs. There is legislation on language inclusiveness, relevant laws. You've got the Racial Discrimination Act, Australian Human Rights Commission Act, and multicultural access and equity policies. Strategies for addressing language barriers within the medical practice or medical field is hiring bilingual workers, interpreting services such as TIS, translation apps. A lot of phones now do have translation, so if you're speaking in a certain type of language, that you talk into that, and then that can then translate that into a language that the worker or a doctor may utilise. Cultural competency training as well, so making staff aware that there are trainings out there to help facilitate that inclusiveness for all. Go down. We're going to cap that one too. So does anyone have any questions in regards to language barriers and that topic?
Yes, I do. Why should we bother with interpreters or translated materials? It just slows everything down.
It may feel like it takes more time up front, but using interpreters actually saves time in the long run. Miscommunication can lead to incorrect appointments, medication errors, and repeat visits. Clear communication means better care, fewer mistakes, and more trust in our service. And I feel that it creates a more inclusive environment when we utilise those services, because it puts that patient more at ease in regards to that. Any other questions?
Yeah, I have one. Shouldn't they learn English so they can live here?
Many are learning English, but medical issues can be complex, even for fluent speakers. When someone is in pain or stress, it's even harder to communicate. So as a healthcare provider, our role is to ensure patients understand and feel safe, not judged for their language skills. All right, we'll move on to the next topic now.